பையனால வாட் இஸ் திஸ்னு கேட்க முடியுங்கிறத இன்னும் நம்பவே முடியல பேரண்ட்ஸ்னால.
ஓகே லைக் வேர் எங்கே என்ன இது என்ன
Child should be encouraged to talk.
yes the environment the curious environment that they come and ask oh what is this எங்கே so
ஓ இது யாரு இவன் என்ன பண்றான் or இவன் எங்க போறான் like what where and who are the first questions that children start asking.
yeah
Third person who is sitting with the parent to train the child.
Social communication and I think that also helps a little bit with like the questioning skills.
Cat is an animal அப்படின்னு சொல்லுவாங்களே தவிர இது என்னது அப்படின்னு கேட்க மாட்டாங்க.
Yeah, first you would greet a person, so that would be the first page. Then asking how are you, that would be the second.
use this card or this picture.
Yes.
So obviously that training must be given.
So thank you for bringing up the adjectives point.
Yeah.
ரொம்ப முக்கியம்.
True.
So coming back to your questions part, நிறைய பேரண்ட்ஸ் பார்த்தீங்கன்னா வாட் இஸ் திஸ்னு கேட்டால் பதில் சொல்கிறான் அப்படிங்கிறாங்க. அதுக்கப்புறம் அவன் வாட் இஸ் திஸ்னு கேட்கணும் அப்படின்னு சொல்லிட்டேன்னா அது எப்படி பாசிபிள், அது எப்படி சொல்லிக் கொடுக்குறது, அது பண்ணவே மாட்டேங்கிறான். ஈவன் ஆஃப்டர் லைக் 7-8 years of into therapy என் பையனால் வாட் இஸ் திஸ்னு கேட்க முடியுங்கிறத இன்னும் நம்பவே முடியல பேரண்ட்ஸ்னால. ஸோ யூ டெல் அஸ் அபவுட் தட் பார்ட். அதாவது ஒரு கொஷனுக்கு ஆன்சர் பண்ணிட்டாங்கன்னா they have to start asking that too. Be any WH question or any question.
Yeah,
right?
so actually asking questions in a very short way, like you know small questions like where எங்கே என்ன இது என்ன. Actually those things come in a very early stages, like around a 3-year-old or 4-year-old. That actually comes because of the curiosity that children have and the thing that we create also. We create the environment, the curious environment that they come and ask oh what is this எங்கே. So that definitely they can ask and definitely can be trained in a very fun and
for sure.
like hide and seek. That can be beautifully trained actually. So that is something that definitely there. And
or through a storybook like different characters, even parent or like it can just you can introduce just like 1 or 2 characters and like let the child like go through the book and they ask oh இது யாரு இவன் என்ன பண்றான் or இவன் எங்க போறான் like or because you will probably be asking like oh இவன் பேக் மாட்றான் எங்க போறான், so he can also ask with a different character of what he is doing, where he is going, because I think what, where and who are the first questions that children start asking.
yeah, and to add on to that this can be very well done in the modeling form because they might think that oh we are asking questions, can we not ask questions because we keep telling don't ask questions, right? But this can also be done very well with the communication partner without really posing the questions on them. The questions can be left on the air and then they can that can be a form of way to encourage the child to actually ask questions. So that
challenge in parents the word you said, right? Communication partner. அப்படினா என்னங்கிறது let us explain it because it's the third person who is sitting with the parent to train the child. So and the person has to model the question, right? If he wants to ask the question. So அந்த மாதிரி environmentல the parent should be able to make the child ask.
Definitely. So coming in the next milestone way, categorizing is something that we can be done very well, and unfortunately many again as soon as categorizing word is being used, it's taken in a very academic way, which can definitely be used in a non-academic way. Like you know for as simple as things like okay now we're going to name all the things that we see on the road. So there's car, there's a dog, like things like that. Or it can be very general also, like in very daily activities also. For example, okay how can we can we pick out all the things that we play with or all the things that we use to make lemon juice or all the things that we use for going to school, like a bag, pencil, water bottle, book or whatever.
True.
So
grouping.
yeah,
Yes,
a
yes.
grouping basically, grouping, but in a very fun and daily environment. So that way they will actually like their cognitive skill of thinking, ability to be like, okay, so if I'm going for a certain thing, for example, if I'm going for a function, for a birthday party, what do you think I should prepare myself to go? So we as adults know that if we go for a thing, we need to have A to Z things with us. For a child to be able to think in that way, we need to like stimulate that in the first way. So we tell them, be like, okay, let's think in that way, let's think broader. So we're actually working on cognitive skills, but at a basic level.
Yes.
That is the right word again.
True.
பர்த்டே பார்ட்டிக்கு போகும்போது என்னெல்லாம் எடுத்துட்டு போகணுங்கிறது சைல்டுக்கு புரிஞ்ச vocabulary so whatever words we use now அவங்க யூஸ் பண்ணணுங்கிற அவசியம் இல்லை.
Exactly.
So the parent are stuck there. இவ்வளோ டீடைலா சொல்றீங்களே இது எப்படி என் சைல்டுக்கு பண்ண முடியும்? So use the right words which child can understand and then you can
True.
Definitely.
Exactly.
So this is for categorizing. Right? When you said categorizing, most of the parents or therapists start with another animals, vegetables,
Yes,
vehicles
yes.
and fruits,
Shapes, colors.
True. So இதுவுமே when I was told இதுல எது அனிமல் அப்படின்னு கேட்க சொல்லல. Coming back to our no verbal demand. Instead they pick up cat எடுத்துட்டு cat is an animal அப்படின்னு சொல்லுவாங்களே தவிர இது என்னது அப்படின்னு கேட்க மாட்டாங்க. So whatever topic we are saying, the initial rule follow பண்ணணும்.
Modeling.
Verbal demand கிடையாது.
Verbal demand,
true.
Modeling.
Exactly.
Yeah.
So what else? Next to categories
I think one of the next things that we will encourage them is social communication, right?
Yeah.
You want to talk more about that?
True, like social communication, and I think that also helps a little bit with like the questioning skills. So I don't want to like take it out separately. It is like, let's call it higher language, like questioning, social communication, pragmatic language, all comes under higher language skills, where the child is able to like greet someone when they meet someone new, or ask them how are you, and if it's a known person, ask if like did you eat today, or I like what you're wearing. Like compliment is like more of a higher language, saying that oh I like what you're wearing, oh we both are like blue matchy, something like that. So acknowledging someone all falls under social communication. And then questioning also comes with that. When you teach your child to ask eppadi irkeenga, that is also like a question. So I know it's a how question, but it's also like a very basic social etiquette. So they will know that a conversation goes back and forth. நீங்க ஒன்று சொல்வீங்க, நான் ஒன்று சொல்வேன். Like you ask something, I answer, and if there's an interesting topic, we stay on the topic. So it's not about like you ask about what you're wearing and I talk about what I'm eating. To stay on the same topic.
அந்த scenario தான் நிறைய நடக்குது.
Yes.
Can you tell the parents நான் எப்படி இருக்கீங்கன்னு கேட்டா அவனுக்கு பிடிச்சது தான் அவன் பேசுறாங்க. How do you think parent can train that, like conversation, staying on topic?
Yes.
Minimal words also.
True. Okay. In a therapy scenario, I would say having like the parent within the session, and then using the parent as a model. So the parent with the child will ask how are you, எப்படி இருக்க கேள சொல்லாம how are you அப்படின்னு அவங்க கேட்டு, and then we will answer I am fine, and then the therapist can ask how are you. So the conversation is made and the child is observing. The child is always watching you, like you as a parent and we as an adult or the therapist if they actually see us as a therapist. So modeling in those ways. And one of the things I would say again to add on for like non-verbal children, it would be yes. True.
Non-verbal children, how do you do it?
Definitely, because I always want to touch upon like non-verbal communication users too. So having like conversation cards which have like first you would greet a person, so that would be the first page. Then asking how are you, that would be the second page. And then something like wait for the response, that could be like in the form of a picture or a blank page. So they cannot go like hi, how are you, and then go to the next question. So hi, wait for the response. How are you, wait for the response.
So cards are what do you
you can yes
parents create cards with those words.
Yes so
does it have a visual attached to it?
It does. So let me explain a little bit more. So it will be like some cards in the form of like probably the size of visiting cards, very small, that they can carry anywhere. And I want the children to be using this in various scenarios, not just at home, not just at therapy, because real progress happens outside the therapy room, right? So to their activity classes, if they go to any, to the teachers, or if they go in the school bus, bus anna kita hi anna, something like that. So to have like a visual of this for hi, and for how are you, it can be like a question or a question mark. And then what did you eat today, something like this. So with the visual, and some of the children who are like probably in their teens have started reading. At least that's the population I have seen. Even if they have not, it's not inhibiting anything, they still have the visual. So having both, so they can pick what they want. They can either read it or they can look at the visual and imitate it. Yes.
So to add on to what Harshni said, like parents might say, oh, can they really understand if I just give a picture of a question mark, will they understand that they have to, it means that?
Yes.
That is taught during therapy.
Yes.
And also not, that has to be taught in a very meaningful way.
True.
In therapy, outside therapy, and with multiple repetition of using the same card for this, that denoting that card for that purpose, they will start understanding. Okay, so for doing that, for that part of communication, I can use this card or this picture. So obviously that training must be given. And with continuous training and with repetitive use, it will become meaningful.
It will be effective.
So what are milestones we spoke about? So all those can be achieved for children who are non-verbal also.
Yes,
Using
100%.
the right method, right visuals, right? And since you are saying that the therapist will teach them, I would say like the connection. The connection between what we say and what's happening has to be clearly taught to us.
And some of the higher language skills that I want to like touch upon, that is that like after simple questions that we saw earlier, reasoning, why questions, understanding inferences. For example, if they come up to us and if they happen to be in a scenario, what type of words in communication, like functional words that they will use during that scenario. So scenario based communication, inferring, understanding all those things,
predicting what might happen
predicting
next.
what happened, correct. So that all are higher language skills, but it can be achieved, and it should be also, because it's sort of connected to thinking, a lot of to cognitive skills, which side by side helps your child to communicate in a larger perspective, like not stick to certain topics or certain specific things. They will start thinking and using the vocabulary in a very large context. So when that is being taught, that also sort of helps in their academics also. That is parents what also want.
True.
So challenge is what parents face. So you said இதெல்லாம் higher languages, right? So ஒரு question always parents come and ask is like need based communication தாண்டி என் child ஒண்ணுமே பண்ண மாட்டேங்கிறான் அப்படின்னு. But the thing is, these are the things நீங்க இப்ப higher languages சொன்னது எல்லாமே has to be taught to the child.
True.
So I mean, I want to ask this question to you. So when a parent comes and asks you, need based talk மட்டும் தான் பண்றான், அதுக்கு அடுத்த லெவல் போக கூடாதுன்னா இதெல்லாம் தான் பண்ணணும்.
Exactly.
So is there anywhere, is there ஒரு template மாதிரி ஏதாவது இருக்கா? Is there say it or anyone who can tell, or it's just the therapist who can tell them what next அப்படின்னு?
I think so. I mean to say there are milestone charts out there, but again, like as we discussed before, you have to understand the language age of this child, where they stand at, and then help them meet the milestones that they have to meet next, and then go in the trajectory. So if they have the need based communication and they're able to like expand to sentences, and they have just started like asking questions, they are kind of ready for the next phase, where like they can do, I wouldn't say like they have to be ready or something, because social communication can start anywhere. Like when a child enters, I want the child to say hi, or the parent to model hi to me, so I can say, hi, I'm so happy to see you, oh I see you're wearing this, and something like that. So that is always happening. I wouldn't say that they have to take like 5 steps to go there, but then to probably get to inferencing or predictions, or to understand humor, probably to start asking questions, build a little bit on social communication, and then get there.
Whatever you both talked, a lot of critical keywords are there, like understanding, predictions. இது எல்லாமே individually it's a deeper topic.
True.
Parents should be aware. That's right. To finally touch upon Aranla, there are a lot of favorite keywords or phrases I would say. Child should be encouraged to talk.
Yes.
They always
True.
parents. So என் பையனுக்கு ஒரு விஷயம் பிடிச்சிருக்குன்னா அதை நல்லா பண்ணுவான். ஸோ why can't you make your child பேசணுங்கிறத பிடிக்கிறத வச்சுட்டோம்னா they will talk better.
True.
So அதை பேஸ் பண்ணி if you can finally wind up on என்ன ஒரு பேரண்ட் குழந்தைய ஹாப்பியாக பேச வைக்கிறதுக்கு என்னெல்லாம் பண்ணலாம் அப்படின்னு நீங்கள் சொன்னீங்கன்னா it will be a good
I mean the basic thing that we need to understand is that we know that communication or using words or any form of communication, I can tell my emotions, I can talk, I just feel good. But unfortunately when the children are trained in the starting stages, when they are demanded with questions, they are overloaded with a lot of things, what happens is that they will start talking, but again that is never ஒரு பிடிச்ச பண்ணுற ஆக்டிவிட்டியே இருக்காது. அவங்க like for this thing to happen I will tell this is sentences, I will just tell it off, but that doesn't really form a good connection with the child. So that's why play based therapy that comes into the thing. Play-based therapy is basically that only. We are encouraging child to talk. That way we do things. So parent will say ki we are pudicha activity da pandringa, other activity panna maatrenga. But again we start off with that. We do what the child likes, then we move on to what the child will not like. Appodan they will actually build a good rapport with the person. Trust varum and பேசுறதுக்கு interest varum. Like நீங்க நான் சொல்றது நீங்க கேக்குறீங்க, so I will also listen to you.
True.
So
and also a little bit of awareness that sometimes like I also have to do things that are not my first favorites.
Exactly.
First I will do what I like and then I'll do what the therapist likes. So it's also like a subtle form of turn taking. So first we'll do my game and then we'll do her game, which could be something structured or a different game that we want the child to actually pick.
So and one more thing that I really want to stress upon, that encouraging your child to talk is that, and then using the right activities also. Don't stick with your activities that you think it's right. If a child really wants to just run around 40 minutes, okay, it's fine. You can tweak it a little bit and you can add on to what you want. The goal base you can tweak it, but again don't be so rigid. To therapists and for parents, for anyone, be child based basically.
And the sensory thing you can
for sure. To add on like a lot of sensory activity.
அதுல இருந்து கூட you can start.
True.
Exactly. It doesn't have to be sitting and doing. A lot of times a lot of therapists, at least and many other therapists also, if the child is just looking at the ceiling, I will lie on the floor and look at the ceiling with them. And that's nice. Oh, look at the brown ceiling. All that we do.
Exactly. So they feel safe. Like a connection should feel safe. Like we as adults open up to people when we feel safe. Like we share our emotions, we share what we want when we feel safe. So the same, like just apply the same ideology to young children who are like just learning all of this.
Exactly.
Good. So it was a good conversation.
I think so.
Awareness month. I thought we will talk something which parents should know. So anything from you as a final word with the parents?
So one thing that I always like to say to parents and fellow therapists is to presume competence, that your child will be able to communicate, engage with you, build that connection, and this goes for both verbal and non-verbal communicators.
And something that I really tell is that I see a lot of parents that I see every single day, they try their best. They try their best. So I like to say that you're doing great. So keep doing it. Give time for yourself. Give time to your child. And just keep at it. Like you're doing great job.
For sure.
Get the right amount of help and also find that help. The world is not so small. It's like you will find the right sort of help and the people to get connected to and get the right help. So find your group and just keep motivated and do your best, and I'm sure you're doing your best, so just keep at it.
I completely agree with that. Kudos to all parents.
Definitely.
Thank you. Thanks for
You're welcome.